A lot of reading lately. Right now I'm reading on peripheral neuropathy or just neuropathies in general. And I'm reading this book called Peripheral Neuropathy When the Numbness, Weakness, and Pain Won't Stop. I will leave the title down below as well as the author. I think it's a great book, very educational, not very long. It's like 174 pages, I believe. When I go to the doctor, every once in a while I could get a copy of my medical records or the transcripts, whatever they're called, or go online with my clinic and see what the doctors are saying. And most of the time I have no idea what they're talking about because it's words that I don't recognize. And then I'm wondering, well, do I have a new diagnosis or what's going on? And Google doesn't always help with that cause. So in this book, there are terms that doctors use to describe clinical syndromes in neuropathy patients. So I wanted to discuss those today. There are 24 of them. 24. I could not believe that there are 24 different ways to just talk about neuropathy. List of terms used to describe clinical syndromes in patients with neuropathy. Polyneuropathy, a diffuse neuropathy, affects all nerves. Mononeuropathy affects a single nerve. Sensory motor neuropathy affects sensory and motor fibers. Sensory neuropathy, only sensory fibers are affected. Motor neuropathy, only motor nerves are affected. Distal neuropathy, most distal parts of the nerves, like your hands and feet, are affected. Proximal neuropathy, proximal muscles, shoulders, thighs are affected. Small fiber neuropathy are small fiber sensory functions affected, and it's usually very painful. Large fiber neuropathy, large fiber sensory functions affected, position, vibration, balance, and coordination. Multifocal neuropathy is multiple nerves at different sites, but some of the nerves are spared. Autonomic neuropathy, autonomic fibers affected, causing autonomic dysfunction, which would be like your blood pressure, your heart rate. Brachial neuritis, brachial plexus nerves affecting arms, causing weakness. Radiculopathy, not sure how it's pronounced, is anterior and posterior nerve roots affected as they leave or enter the spinal canal. Can be motor or sensory nerves that are affected. Polyradiculopathy, multiple nerve roots are affected. Neuron neuropathy, nerve cell body, not the axon processes. Sensory neuron neuropathy or sensory ganglion neuritis is what it's referred to as well. And your axons are a thread-like part of the nerve cell along which impulses are conducted from the cell body to other cells. Neuritis, inflammatory condition causing neuropathy. Demyelinating neuropathy, primarily the myelin sheaths, which are a membrane that cover your large fiber nerves of the peripheral nerves, are affected. Axonal neuropathies, nerve axons, primarily affected. Ataxia is unsteady gait. Acute onset neuropathy starts suddenly or progresses for up to 6 weeks. Chronic neuropathy slowly progresses more than 3 months. And subacute neuropathy between acute and chronic somewhere, and it progresses 6 to 12 weeks. Now, there's so much more in this book, and I will probably do another video. One of the ones I kind of want to cover is some of the causes of neuropathy. There's hundreds, and some of them that I have read I have known about, and some of them I haven't.